Hello, my name is Kathy, and today I will be continuing the discussion on how to use homeopathic remedies on ailments, continuing with fertility and pregnancy, M. But before I do this, I wanted to let you know that because I have a great many videos now on many different topics, that I've decided to make several different video playlists so that it's easier to find the videos of greatest interest. So please check out my playlist page. Please refer to my How to Use Homeopathic Remedies video before using the material in this video. I'll be discussing how to use homeopathic remedies on specific ailments, but I've broken these ailments into categories for easier reference. I'll begin with ailments of the mind and emotions. Then I'll move on to ailments of the brain and nervous system. Then I'll address issues with your skin, nails, hair, eyes, ears, nose, teeth, gums. Then issues with lungs, respiration, heart, blood circulation, muscles, bones, joints, esophagus, stomach, and duodenum, small and large intestine, liver, gallbladder, pancreas, kidney, bladder, then ailments specific to women and then specific to men, then issues of the hormones and metabolism, then homeopathic remedies for infections, infestations, and the immune system, issues surrounding fertility and pregnancy and surrounding childbirth and postnatal problems, then homeopathic remedies that address special problems in infants, ailments and diseases in childhood, and special issues of adolescence, and finally, special issues of the elderly. Constitutional treatment involves treating the totality of the individual person. Everyone is a unique individual with a unique physiology that responds to substances differently. In homeopathy, it is recognized that people will react strongly to certain remedies, and as a result of this, they can be loosely placed into different categories called constitutional types. Homeopaths talk of, for example, phosphoric types. These are people who react strongly to phosphorus, or Arsenicum album types, those who react strongly to Arsenicum album. The belief is that people of one type share similarities in terms of body shape, character, and personality, and the sorts of diseases from which they suffer. As an example, Natrum people tend to be pear-shaped, have a dark complexion, be fastidious and rigid in personality, and keep themselves to themselves. They also crave salt and suffer from constipation. As another example, Lycopodium types tend to be tall, gangly, and of a stooped appearance, with an anxious expression and a craving for sweets and a propensity to produce intestinal gas. Now, of course, constitutional types have their limitations. In reality, each person is an individual, and so there are as many constitutional types as there are human beings. An account must be taken of the sum total of the person's inherent predispositions, past illnesses, diet, general reactions to the environment, intellectual and emotional features, and general attitude towards life. This is what is meant by constitutional treatment. I'll be making detailed videos of the various constitutional types after I've completed the use of homeopathic remedies on ailments. The ideas, procedures, and suggestions in this video and all my homeopathic videos are not intended as a substitute for the medical advice of a trained health professional. Consult your physician before adopting the suggestions in this video. If you're pregnant, do not attempt these techniques without the approval of your physician. So, let us continue with learning how homeopathic treatments can help with fertility and pregnancy. M. Every month during a woman's reproductive cycles, a ripe egg is released from her ovary and enters the fallopian tube, and the mucus at the entrance of the womb at this time becomes less sticky. If intercourse takes place, millions of vigorously swimming sperm make their way through the mucus into the womb and into the fallopian tubes, where they congregate around the egg, causing it to spin around with the movements of their beating tails. Eventually, one sperm penetrates the egg, and the nuclei of sperm and egg fuse, and the process of cell division begins. The fused nuclei split into 2 cells, then 4, then 8, then 16, all containing the 46 chromosomes that will create a new and totally unique human being. 7 days after fertilization, this ball of cells embeds itself in the wall of the uterus. At 20 days, the placenta begins to form. At 30 days, the spinal cord. At 6 weeks, the heart. And by 13 weeks, all the body organs are formed. At 5 months, the baby can be felt to move. At 6 months, the lungs become functional and the nostrils open. At 7 months, the baby should be in the head-down position, ready for birth. A full-term pregnancy usually lasts 38 weeks, counted from the moment of conception to the time the baby is born. Conception usually takes place halfway between periods if the woman's cycle is 28 days and regular. However, since many women's periods are not exactly 28 days, pregnancy is usually measured as being 40 weeks from the first day of the last period. Common pointers to pregnancy are missing a period, more than usual tenderness or swollen breasts and darker nipples, nausea, tiredness, a frequent urge to pass urine, and sometimes loss of appetite or cravings for unusual foods. To confirm the pregnancy, the woman should have a pregnancy test. The chances of having twins are about 1 in 80. Identical twins develop from the same egg and share the same placenta. Non-identical twins develop from different eggs and have a placenta each. Only 3 pairs of twins in every 10 are identical. Triplets are much rarer and only occur in 1 in every 6,400 pregnancies. Once it is determined that the woman is pregnant, it is important for her to go for regular prenatal checkups. Prenatal care is important since it allows you to find out at an early stage if there are any problems. An ultrasound, which is a sound picture of the baby in the womb, is thought of to be harmless to mother and baby and can be used to monitor the size, shape, and position of the baby at any stage of pregnancy. Amniocentesis, which is the taking of a sample of the amniotic fluid around the baby, is usually carried out between 16 and 18 weeks, but only if a previous baby has been abnormal or if there is a family history of congenital problems or if the mother is over 35. Here in brief are some of the do's and don'ts of pregnancy. Treat your baby as a person from the word go. Moderate exercise, such as swimming and walking in the fresh air, are very good, but anything that involves repeated compression of the spine, such as horse riding or trampolining, should be avoided. Always keep 25% of your energy in reserve. Do go to prenatal classes. They will teach you what to expect and how to breathe in order to cope with pain during labor. Don't wear tight clothes and get as much sleep as you can and avoid late nights. Also, don't sit in hot baths for too long. 10 minutes is about the maximum, especially if you faint easily or have a tendency to bleed. Avoid serious traveling if you can, especially if you have a threatened miscarriage or there are complications or you suffer from travel sickness. Most airlines do not like you to fly after 32 weeks or so. So if you must fly, check with the airline first and stop working before 28 weeks, if your work is very strenuous. The expectant mother needs to eat a healthy, well-balanced diet with an increase in iron and calcium foods, and also a modest increase in protein intake, preferably in the form of oily fish, nuts, seeds, pulses, and whole grains, with generous helpings of raw vegetables and fruits, will help to guard against a constipation. Tea, coffee, and alcohol should be avoided, as well as chamomile tea, especially in the latter stages of pregnancy. Homeopathic remedies during pregnancy. During the first 3 months of pregnancy, the most vulnerable time, you should avoid all medications if you possibly can. That means prescription drugs, recreational drugs, over-the-counter preparations from drugstores and health food shops. There is no evidence that homeopathic remedies cause any problems during pregnancy, but to be on the safe side, they should be taken in potencies. They should not be taken in potencies less than 6C, except for tissue salts. It is probably best to avoid low-potency apis altogether and take 30C if you need to. For minor complaints during pregnancy, homeopathic remedies should be tried first. If you feel very unwell, see your doctor before taking anything else. Miscarriage. The main cause of miscarriage, defined as losing a baby before 28 weeks, are fetal abnormalities, structural problems in the uterus, cervical incompetence, hormone imbalances, and falls. However, miscarriage as the result of a fall is rare. The baby is well protected inside the womb. Losing a baby after 20 weeks is technically speaking a stillbirth if the baby is dead. A premature baby is a live baby born after 28 weeks, but before term. A miscarriage is inevitable if the fetus dies in the womb. This is technically a missed miscarriage. if there are no symptoms, and morning sickness and fullness in the breasts disappear, and at your next checked up, your doctor will find that your uterus has not increased in size. Usually, however, there are obvious signs: discharge of blood and solid matter from the vagina, and crampy pains in the lower abdomen and back. If part of the fetus is retained in the uterus, this is an incomplete miscarriage. Pain and bleeding may persist for several days. Scanty brown or bloody discharge at around the time when periods are due is not uncommon. This is a threatened miscarriage, but in most cases, the baby is not lost and the pregnancy proceeds normally. Any vaginal bleeding during pregnancy is potentially serious, so the best course is to see a doctor within 12 hours. If bleeding is associated with abdominal pain, see a doctor within 2 hours and give one of the remedies listed under ectopic pregnancy. If you pass any solid matter, keep it for the doctor to see. In the meantime, rest, since it is usually necessary to remove the remains of the fetus and placenta from the uterus under general anesthetic in order to prevent infection and anemia. Don't eat or drink while waiting to see your doctor. Have constitutional homeopathic treatment afterwards. Specific remedies to be taken every hour for up to 10 doses while waiting to see your doctor. Bleeding and pain after a blow, a fall, or a particularly violent movement. Use Arnica 30C. Feeling feverish, restless, thirsty, and very worried, dry skin. Use Aconite 30C. Steady loss of bright red blood, cramping pains in abdomen, weakness, nausea. Use Ipecac 30C. Appearance of dark coagulated blood towards the end of the 3rd month or at a time when periods would normally occur. Tearing pain between the lower back and vagina, nausea and vomiting, diarrhea. Use Sabina 30C. Face hot and dry, distended abdomen, bearing down sensation in vagina. Use Belladonna 30C. Feeling very nervous and agitated, unable to sleep, vulva and vagina extremely sensitive. Use Coffea 30C. Intermittent bleeding that is more profuse each time it occurs. Blood dark and coagulated, cramping pains. Use Pulsatilla 30C. Profuse discharge of thick, blackish blood, feeling weak, exhausted, and afraid of dying. Use Secale 30C. Missed miscarriage, no symptoms. Use Sepia 30C, followed by Coffea 30C. Morning sickness. Many women, especially first-time mothers, experience nausea and vomiting in the 2nd and 3rd months of pregnancy, and not just in the mornings. Symptoms usually wear off by 14 to 16 weeks, although a few women go on to develop hyperemesis, severe vomiting that causes fluid and chemical imbalances and may require hospital treatment. As a first resort, try the self-help measures below. If these do not help, try one of the homeopathic remedies given below or see your homeopath. If you are vomiting most of your meals, see your doctor. Anti-vomiting drugs are available, but there is increased reluctance to prescribe themselves. Specific remedies to be taken every 2 hours for up to 3 days. Nausea is worse in the morning, vomiting small amounts of food with mucus in them. Use Nux 6C. Nausea nonstop, everything vomited up, liquids and solids. Use Ipecac 6C. Nausea in the evening, wearing off at night. Use Pulsatilla 6C. Nausea a few hours after eating, suddenly vomiting everything up. Use Ferrum 6C. Vomit full of milky mucus, especially if temperament is melancholy, irritable, and weepy. Use Sepia 6C. Breasts hard and swollen. Use Conium 6C. Heartburn, keeping nausea at bay by constant eating, getting up at night to eat, aversion to meat and fat. Cabbage aggravates symptoms. Use Petroleum 6C. Diarrhea, burning sensation in abdomen, feeling restless and exhausted. Use Arsenicum 6C. Aversion to bread, fat, and slippery foods. Craving for salt. Feeling very thirsty. Use Natrum 6C. If none of the above remedies seem appropriate, use Sulphur 6C. Self-help. Eat small, frequent meals. Avoid greasy food and get plenty of rest. If you feel sick in the mornings, a dry cracker before you get up might help. Using fresh ginger in cooking can also help. An acupressure device called a C-band worn around the wrist may also be effective. I have a great many videos on many different topics, so I've decided to make several different video playlists so that it's easier to find the videos of greatest interest. So please check out my playlist page. Well, that's it for now. To stay up to date with my latest videos, make sure to subscribe to this free YouTube channel by clicking the red subscribe button right below this video. Take care.